Welcome to Plan ORE. This is an introductory video on what a DTP is. A DTP is one of the components of the ORE Part 2 examination, and in this video we are going to explain to you as to what it is, how is the exam conducted and marked, how you need to prepare for it, and how we at Plan ORE will help you in doing so. So stay tuned for this video. For your benefit, this video has been divided into two parts, so make sure that you watch the other part as well. And if you like us, give us a like or subscribe to us and contact us through any of the following. So let's begin with what DTP is. As we all know, the full form of DTP is Dental Treatment Planning. And what exactly it is, it's a puzzle. And you need to solve it. It's as simple as that. That means they're going to give us some bits and pieces like in a jigsaw puzzle, which comprise of the patient's history, which you're going to take, the clinical findings and the x-rays which they are going to provide, and using both of them you're going to diagnose it, treatment plan it, and finally present it to the patient. So what factors do you need to consider while preparing for the examination? The most important one is the time. It's a 54 minutes examination and you need to finish the entire case in 54 minutes. So whenever you practice at home, make sure that you do it on time and you practice it with a clock. You should be thorough with the clinical aspects of knowledge and how to diagnose and treatment plan it in accordance to the latest guidelines. You should be confident while you're taking the history from the patient as well as explaining him the treatment plan. In case he asks you for an opinion, you should be able to justify your treatment plan. You should be able to convince the patient that whatever options you are offering him are the best. At all points of time, you should be sympathetic and considerate with the patient. And it should be kind of a conversation and not like a lecture. So you should be able to look into his eyes, talk to him convincingly with confidence. So let's get started on how would you prepare for it. The first thing you need to do is to download the DTP sheet from the GDC website, which is given under the DTP guidance link. Once you download it, make sure that you take a few prints of these DTP sheets and keep it along with you, so that whenever you're practicing DTP, you practice it around on the sheet. That will help you understand the amount of time required to fill the sheet, as well as the space given and how you need to fit your handwriting in it. Books are usually not required. However, it is a good idea to always keep referring your Part 1 books like your Pink Book, the Caution and the Odell. Make sure that you whenever practice you have a clock and you write it with the help of a pencil, because in the exam you're given a pencil to fill the sheet. We at Plan ORE will cover all possible case scenarios through online sessions. So this is the DTP case sheet which you would be downloading from the GDC website, and here you can see the first page of it, which is blue in color. So you totally have 9 pages, 2 blue sheets, 3 orange sheets and 4 green sheets. Now the number of sheets is directly related to the amount of time. This is the face of the clock which you can see in the examination, and as you can see it is divided into 4 parts and they are all color coded. So the first 10 minutes tells you that you need to finish your blue sheets. The second 11 minutes you need to finish your orange sheets. The next 23 minutes you need to finish up your green sheets. And the last 10 minutes you need to present your treatment plan to the patient. So this clock also gives you an idea about the color of the sheets you would be using at that period of time, as well as it gives you an idea of how much time is left and how you need to speed up. So when you enter the main room during the examination, you're given a piece of paper which comprises of the patient's chief complaint and gender. For example, there is a male patient who has severe pain on the left hand side. So you get an idea about the sex. So if it's a female patient, you can just make a quick note that in the medical history you need to ask about the pregnancy, the oral contraceptive pills and the menstrual cycles, which you won't be asking in case of a male patient or an older female patient. The chief complaint gives you an idea about what extra questions will you ask and how will you take a detailed history. So if it's pain, you would be asking about the character of pain, whether it's continuous or intermittent, and so on. So utilize this time to make a mindset about the questions you would be asking once you enter the room where the patient is sitting. They also give you an X-ray, but remember that this X-ray does not belong to the patient. It's just a photograph of the X-ray which you can see on the page. This X-ray needs to be interpreted on the green sheets. Like what side of X-ray it is, what kind of an X-ray it is, what is the bone level, are there caries present, what are the number of teeth present, and so on. So this is just to test you whether are you able to read an X-ray properly or not, but in no way is connected to the patient. So they give you this X-ray in the beginning so that you have an idea about what kind of X-ray you're going to have inside and how would you interpret it. So again, utilize your time properly and just make a quick note of what it is so that you save your time while you're actually interpreting it inside. So when you enter the room, your 10 minutes start. So be careful that you quickly find out where the clock is. Greet the patient and or the examiner if you want to, and quickly take your seat. The first thing you need to ask is the patient's name, address, date of birth, and the phone number. Now, there is a chance that because these are all proper nouns, you may not be able to hear them properly on the first go. But don't waste time asking the patient to spell his name or the address or to repeat it, because you really don't have much time and you have a lot of questions to ask. So the best thing is to write down whatever you can hear at that point of time and leave it. The good thing is that on the subsequent pages, that is after this page, the name, address, the date of birth, everything is written down, so you can just copy it later on. So at this point of time, just write what you can hear and go on. There are a few more questions which you can add or which you can ask in the introduction. That is whether he is married or not, whether he has any dependents or not, what does he do for his living, what occupation he has, and how does he define stress? Is it low, high, or medium? Now these are actually the social history questions, and you can also ask them when you're asking about the social history. That's completely fine. But we recommend you to ask it in the introductory phase because this helps to build a rapport with the patient, which is very, very important. So once you greet the patient, you tell him that you will have to ask him a few personal questions. When he says yes, you ask him the name, address, and the social history questions. And then you tell him about the complaint or ask him about his complaint. Like you can say that my notes say that you have pain, or can you tell me what brings you here, Miss Jones? At that point of time, the patient will tell that he has severe pain on the left hand side or whatever his complaint is. So you again give him sympathy and tell him that I'm really sorry to hear about it, but I will have to ask you a few more questions. And once he or she says yes, you begin asking a detailed history about the pain, like when, where, its character, sleep disturbance, radiation, and so on. When we discuss different cases, we will be telling you what questions need to be asked at that point of time. You next go on to the medical history, where you can ask about any medical diseases he or whether his family is suffering from. So there is a proper mnemonic for it. Like A stands for allergies, B stands for bleeding problems, C stands for any chest problems related to breathing or heart, D stands for any drug the patient has ever taken before, E stands for any endocrine problems like diabetes or thyroid, F stands for any fits and faints, that is epileptic attack, G stands for any GIT problems, H stands for any hospitalization in the earlier life, I stands for any infections like HIV, hepatitis B or C. And then there are a few more questions like whether he has taken steroids ever before, or does he have a family history of any diseases, especially diabetes or hypertension. And if it's a female, you would go on with asking about the oral contraceptive pills, the pregnancy, and the menstrual cycle. This is all given in your notes and would be again explained in the subsequent videos, so you don't need to worry about it at that point of time. Whatever history is positive, you need to mention that. If there is no significant positive medical history, you just need to write down no medical history. You can then ask about the dental history, where you ask about how many times does he brush? He brushes it with a manual or an electric brush. Does he use any interdental aids like a floss, mouthwash, or any interdental brushes? Is he a regular or an irregular dental attendee? When was his last dental treatment and what was done? And if he has any extractions, and why did he get it done? Does he have any prostheses? And the subsequent questions of prostheses like why was the tooth removed and what kind of prostheses he has and so on. Does he grind his teeth? Is he anxious about the dental treatment? You then come to the social history, where you remember that you have asked a few questions before, so you don't need to repeat them. Now you ask about the smoking, as to whether he smokes and how many cigarettes per day since how many years. If he says that he doesn't smoke, make sure that you ask that did he smoke before. Drinking, how many units per week, what kind of alcohol. Fizzy drinks, that is the acidic content, low, high, medium. Diet, well balanced or vegetarian. Sugar content, low, high or medium. And then you come to the notes, financial and time constraints. If the patient has any financial or time constraints, you will make sure that you include them in the treatment plan. And what expectations does he have from the dental treatment you will be offering him? This finishes the first page of your blue sheet. So the idea here is to be fast, precise, and to learn the questions in a proper order. At the same time, talk in such a way that it doesn't sound like you have by-hearted it, but like a conversation. When you move on to the second blue sheet, it's quite plain and it doesn't have any much subsections in it. This is if the patient has a third chief complaint. Probably you just have the first and the second chief complaint and you take a detailed history here itself. In case the patient has a third chief complaint, you move on to the second page. If he doesn't have a third chief complaint, you leave this page blank. So this was the end of part 1, where we discussed general features of DTP, how you would study, and we discussed the first 2 blue sheets. So catch up the rest of it in part 2, where we will be completing the DTP sheets, green, orange, and the presentation part. So if you like us, please come and join us or contact us through any of the following website, phone number, or mail ID, and join our FB and WhatsApp group for any questions. Thank you for listening. Bye-bye.